Hello everyone. In our today's lecture, we will study about pharmacology. Yeah, we all know that pharmacology is a kind of tricky subject of medicine. The first question which comes in our mind after pharmacology is what is pharmacology? Pharmacology is a branch of medicine and pharmaceutical science which deal with the drugs and their medications. Now, what is drug? Drug, it is a substance which is intended to be used for modifying or exploring the physiological and the pathological state for the benefit of recipient. Now, how can we give the drug to the patient? There are some routes of administration. There are mainly two routes. One is local and the other one is systematic. Let's start with local route. The local route, it is the route in which we directly give the drug to the infected area. For example, eyes and skin. These are the area where we can give the drug directly. Next is the systematic route. This is the route in which we give the drug through systematic circulation. We cannot give drug directly to the infected area, such as heart. Now, systematic route is mainly divided into two classes, enteral and parenteral. Enteral means intestine and parenteral means away from intestine. Now, enteral is again divided into two classes, that is oral and rectal. Oral, which is above from intestine, and rectal, which is below from intestine. Now, parenteral, it is also divided into two classes, that is injectables and non-injectables. Injectables have three classes, that is intravenous, subcutaneous and intramuscular. Non-injectable also have three classes, that is sublingual, nasal and inhalational. Now, what are the degrees for these injections we gave? Intravenous, it is given at 25 degree, subcutaneous, it is given at 45 degree, and intramuscular, it is given at 90 degree in standing position. Now, a concept comes, which is risk benefit ratio. This is that how much the drug will benefit a person and how much the risk to the recipient. Example, streptococcus. Its risk benefit ratio is good in myocardial infarction but not in case of peripheral vasodilation. Now, pharmacology is mainly divided into two classes, that is pharmacokinetics and pharmacodynamics. Let's start with pharmacokinetics. Pharmacokinetics is the study of what our body does to the drug, or the movement of drug into, through and out of the body. Now, pharmacodynamics. It is the study of what drug reacted to our body. It includes the affinity and the intrinsic activity of the drug, as you can see from the picture. Now, there are some basic principles of pharmacokinetics, which are mnemonically we can learn that A, D, M, E, which are absorption, distribution, metabolism and excretion. We took a drug in our body that firstly it goes to our GIT, then from GIT it is absorbed, then it distributes, then there is metabolization, breaking down of drug, and then excretion of that drug. Now, let's start with our first principle, that is absorption. In case of absorption, we take an example of oral drugs. Oral drugs that are mainly taken through mouth and goes to the GIT, then further to intestine and stomach, and from stomach or GIT the drug will have to move into the blood circulation. For moving into blood circulation, it has to pass through some layers of stomach and blood vessel. As you can see from the picture, firstly it has to cross the layers of stomach, then it has to cross the layers of blood vessel. For crossing, for this purpose, there are some conditions to be followed by the drug. Let's talk about these conditions. The first condition, that is lipid solubility. The drug must have been lipid soluble for crossing the membranes. The drugs which are lipid soluble are mainly present in non-ionized form, and the drugs which are water soluble are mainly present in ionized forms. The example: H2O is non-ionized form, and we take ionized form, it's H plus OH. HX, it is any drug, and H plus X minus, it's non-ionized form. Second condition is similar medium. The drug must have to be in similar medium. Like if the drug is acidic, then it will cross the membrane from the acidic medium. If the drug is basic, then it will cross the membrane from the basic medium. Let's take an example with drug and medium. If the drug is acidic and medium is also acidic, then the drug will cross the membrane. If the drug is basic, the medium is basic, then the drug will cross the membrane. If the drug is acidic and medium is basic, then not, and the drug is basic and medium is acidic, then also no. Example number 2, we can take the example of oral drugs now. Like aspirin, we all know that aspirin is acetyl salicylic acid, which is an acidic drug. We took the drug in our body, it will go through GIT to the stomach. As there is acidic medium in stomach, it will cross the membrane, as the drug is acidic and the medium of stomach is also acidic. Now morphine, it is a basic drug, it will not cross the membrane through the stomach. That's why it will goes to the intestine, and from there it will get the basic medium, then it will cross the membrane easily. Now a concept comes in absorption, that is bioavailability. It is the fraction of the drug which will reaches to the target. If the drug have high bioavailability, then we have to give the low dosage of the drug. Basically, we can say that the bioavailability is directly proportional to absorption. We can take the example of sublingual route. It will directly go to the circulation by lingual vein. Nitroglycerin, used sublingually, used in attack of angina. Its self-administration is possible, and it also works within few seconds. That's why we can take nitroglycerin, keep nitroglycerin at our homes, because its self-administration is possible. Now there is a formula of calculating bioavailability. How can we calculate the bioavailability? Firstly, we will talk about the fact. There is a fact that bioavailability of intravenous route is 100%. Now let's take an example of any A drug which is given by oral route. For calculating its bioavailability, we will plot two graphs, first of IV route and then of oral route, both plasma concentration graphs. As you can see from this graph, the plasma concentration graph of IV route have higher peak than the oral route. These graphs we can call the area under graph for IV route and area under graph for oral route. The formula for these is bioavailability equals to the area under graph for oral route upon area under graph for IV route multiplied by 100. Now the next and the last concept in absorption is bioequivalence. If there are two brands of the same drugs having almost same bioavailability, then they are equivalent. Let's take example of a drug, aspirin. As we talked about it earlier, acetyl salicylic acid. There are mainly two bioequivalent drugs of aspirin, which are first ecosporin, which is of 100 mg per deciliter, and the next one is losporin, which is 80 mg per deciliter. As the difference between both of the drugs is of approx 20%, then we can call these drugs as bioequivalent. If the difference is more than 20%, then these are not bioequivalent drugs. There is an exception in bioequivalence, that is phenytoin. Phenytoin is the only drug having no bioequivalent drugs. Thanks for watching our lecture, and don't forget to subscribe for the upcoming pharmacological lectures.